Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. Woo! Look who we have in the house, Dr. Doreen Granpeesheh. Good morning.
Good morning, Shannon, and good morning, everyone.
So, we want to tell everybody we are live right now. It is Tuesday, November 4th. It's election day. I meant to wear my sticker. I voted early this morning. But it's 2025. So, this is live. We're doing this live. We are live right now on Facebook, YouTube, and Twitter. If you guys want to be writing in questions right now, we are absolutely live. I mentioned that Dr. Granpeesheh is here. She's a true expert in the field of autism. She's been working in this field for more than, is it more than 45 years now? It is, right?
Yeah,
That's
I think
crazy.
it is. Yeah, it is for sure. In 3 years, it'll be 50.
So you started
Right.
when you were 6 months old, is what you're telling us. Uh,
Gosh, can you believe it's that long? It's
no,
pretty
I
amazing.
can't.
It's just crazy.
I can't believe that. But Dr. Graham Pichet is a true expert in this field and I believe the expert of our time and has been so critical at being an advocate for the individual and for their individual medical needs. Maybe later on we can talk a little bit about the term medically enhanced ABA, which you have coined so aptly. Um, and she's also been amazing at seeing around corners and seeing things that were coming, like insurance, to be able to help the field and to be there also for the family that surrounds the individual and their individual needs. I don't think there's been anybody who has been more mindful about all three of those things. So, four of those things. So, we're thrilled to have this time with her where she's going to answer questions for you guys that you write in. As I said, we're live on Facebook, YouTube, and Twitter. Our fabulous Chris Desmond already started showing you some of the different ways that you can interact. I want you to know that when you're on Facebook, YouTube, or Twitter and you want to ask a question, just stay on that platform, ask the question, and it shows up here, and we're able to ask Dr. Doreen your question. We do tell you that there is no format like this that we could do this where we could give individual specific advice. So she will answer your question, she'll ask you more questions, and she will give you information that you can then take back to the expert who has eyes on the situation. So that's an important distinction. I also want to note that many of you watch us later. Watch us later and listen to us later. I hope that you're watching this show on the YouTube channel that is named Ask Dr. Doreen. Please watch Ask Dr. Doreen there. Or you can listen in podcast. It's a free download wherever you get your podcast. You will get advertisements on that podcast because it is a free download. If you do not want to have those advertisements, you can go to glow.fm/autism live, subscribe for $5 a month, and then you get absolutely everything that we do at the Autism Network. It shows up in your inbox with no ads, and it's $5 a month, so you can't beat that. If you're on the treadmill and you need it ad free, that's your opportunity to do that. Did I leave anything out? I don't
Nope,
think so.
ready to go.
Okay, so our topic today is that's just our starting topic. We'll take questions about absolutely anything, you guys, and you can be writing in the chat. But our topic today is, what age is ABA no longer effective? Which I think is a really interesting question to begin with. And I don't know if you want to start right there or you want to start with a question, Dr. Granpeesheh. What would you prefer?
Well, I mean, we can definitely start right there. And I would just respond by saying ABA is always effective. There is no age at which point ABA doesn't work because it is, it's just how human nature is. Like ABA has to do with behaviors that are rewarded are increase and behaviors that are not rewarded decrease, and that is human nature. So ABA is, we take that principle and we use it to teach our kids a lot of different things. But even if we didn't do that, that's how life is. That's how living is. Without ABA, even those things in our environments that reward us, we tend to do more of those things, and the things that are not rewarding, we tend to do less of. So how humans behave.
I have often said that I wish that ABA had its own PR representative,
Yeah,
because I believe that ABA is one of the greatest misunderstood things in the world,
I
and
agree.
and it makes me crazy.
Yeah.
And so this question to begin with makes me a little crazy because I loved your answer, but it really goes to show how little people understand ABA and what the
Right.
science is. And you just told us a little bit about that, and the fact that ABA is not just something that's used for autism.
No, 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 not at all. In fact, so like we can talk about it a little bit, right? So we forget about, the ABA that we do with kids with autism. Let's just put that aside for a minute and talk about what ABA is and how in our environment it just exists. It's sort of how we develop and grow. So, as I said, ABA is based on this principle of psychology called operant conditioning. A lot of people know classical conditioning, Shannon, which also plays a role in ABA. Which classical conditioning is sort of Pavlov and the dogs, right?
Right.
Where the dogs, every day Pavlov, this scientist would go and feed the dogs, but he would also have a bell. And so the dogs realized that every time they hear a bell, they're about to get food. And so they started salivating at the sound of the bell. That's classical conditioning. It basically means that two stimuli, two things in the environment, when they occur together, one takes on the power of the other. So the food basically gave its power of producing salivation over to the bell. That also happens in behavior, and we do use that. The concept of prompting is an example of that. But ABA is mostly operant conditioning, and operant conditioning is very simple. It basically means that everything that results in a reward is going to increase, and things that don't result in a reward are not going to increase. They're going to go away eventually. So now in life, think about that. So you uh, go to, when you're young, let's say when you're a child, you go to school and your teacher is very proud of you because you get a really good grade. And so that becomes a rewarding thing to some children. And then they become the type of child that will always try to gain the reward of the teacher by studying a lot.
Yeah.
Another child may go to school and do something naughty or bad, and the teacher might put that child, tell them, "Hey, go and take a walk around the campus because I don't want you in my classroom." That child will learn, okay, you know what, this is kind of cool. Walking around the classroom, even though the teacher might have intended it to be a punishment, is actually a rewarding thing for the child. So from here on, he learns, I'm going to be doing bad things in class because they'll let me be free.
Yeah.
It is really all about that. And as we get older, you can apply this same principle to everything. Everything. You meet someone and you speak to them at a bar or a restaurant, and they respond to you in a certain way. They smile and they're friendly. That's very rewarding. And so you learn, oh, this is good. This is how I'm supposed to, talk to people if I want them to respond to me positively. And that becomes part of your personality. You go to work. When you go to work, you get lots of different rewards. Obviously, some of the rewards are intrinsic, so there are things like I feel good about my job. And some of them are extrinsic, so things like I get a paycheck at the end of the month. That paycheck is the reward. So even though you don't want to get up in the morning, you will continue to go to work because you will get that paycheck. That paycheck is a reward. So pretty much everything in life can be most things can be attributed to this type of conditioning, which is called operant conditioning. And that's really all we do. Like, we essentially look at our kids and we say, okay, let me first find out what's rewarding to this child. And it's going to be different things, right? Some children enjoy, I don't know, crunchy foods. Other children enjoy toys, other children enjoy having time outside with a parent. Every child has different rewards. So we make sure to familiarize ourselves with that, because ABA without knowing a child's reinforcements doesn't work. It just doesn't work. So you take those, and now you have the power of being able to have the child do something good that you want and then give that reward. So that could be something as simple as imitation of a sound, because you're teaching the child language and then you reward it. And it can be as complex as something like teaching the child how to play with friends appropriately, or, do a very difficult task instead of, let's say, aggressing. So, all of those behaviors, anything that we want the child to do more of, we prompt, we model, and then we reinforce. That's all ABA is. That really is what it is. And I agree with you. It has really gotten a bad rap. And people misunderstand what it is and think that it's not a positive thing and that it's not going to be good for their child.
Yes, and that's so upsetting to me after my experience of my child just thriving once, because I love when you talk about that it made his world fair. There were things that he didn't understand, and then it was like he got the cheat codes for it, and suddenly it was fair. And the choices that he made were based on being informed. Even as a 3-year-old, when he didn't have words, but he understood, oh, this is what they need, and if I do that, then my whole world becomes so much nicer. And so he
Absolutely.
learned how to learn. It was
Yeah, absolutely.
amazing.
And I love the way you explain that, because it also bring highlights another really important thing that happens when you're learning skills. So when you are, let's say you're a child who doesn't really understand language, and a lot of our kids when they're very young are having a harder time picking up language and understanding what's really going on around them for lots of different reasons. And when you start to understand those things, and really when you start to be able to attend and be able to understand what's going on around you, the environment becomes naturally more reinforcing, right? So, like being, there are lots of children that I meet who want so badly to have friends and be able to interact, but they can't. They don't know how. The other children are interacting at a different level. Our child feels left out, isolated, doesn't understand why, starts to feel really bad about him or herself. And so, as we teach these skills, and the child is actually able to, as you said, have access to those things in society that are rewarding, it is kind of like a self-fulfilling prophecy. Like we're teaching more and more, but the child is also getting more and more access to reinforcers in their natural environment. So overall, it's a very, very positive experience.
Absolutely. So let me dive into some of these questions these are real questions. My 12-year-old daughter was just diagnosed with autism. The developmental pediatrician says she's too old for ABA, but my sister-in-law says that's crazy. What are your thoughts?
That is crazy. It's someone who doesn't understand. So, there's a lot of attention was given years ago to using ABA to teach a really, really large amount of skills, large number of skills. And that's what's called a comprehensive program. So when you do a comprehensive program, it's generally going to be with a very young child, because your goal is very big. You're like, I'm going to teach this child everything that he or she has not learned for whatever reason. And you want to start with a child who's, let's say, 3 years old, because there's just a massive amount of stuff to teach. And you don't have a lot of time, because by the time the child gets to be, let's say, 6, now you also have to have them in school, and now academics become part of the child's regimen as well, and you just don't have enough time to teach all these things. And for parents, when they see the curriculum we've put together, which isn't even, there's things missing even from our curriculum. But when you look at it, you realize, oh my God, like, there's thousands of lessons to be taught. And some children who are very severely affected, they need to learn a lot of those thousands of lessons, and it takes a lot of time. So these comprehensive programs tend to be very intensive, kind of 40 hours a week for 3 years, 4 years, whatever we can continue to do. That kind of a program got a lot of attention in publication and literature because that's really uh, those programs and comprehensive programs that have the most dramatic effect, I would say, on kids. And there are lots of kids who lose their diagnosis if they've had enough years and intensity of ABA. So, because of that, everyone in the world started to think, okay, it's really just for young kids.
Yeah.
It's really just comprehensive program. It has nothing, not at all, not at all. So, there are thousands more publications that have to do with adults and teaching them various things using ABA techniques. It's just that it's not a ton of things, it's specific things. And these are more focused programs because they're focused on one thing or another. They could be focused on safety issues, they could be focused on, tasks, skills, they could be, and it really then has to do with the adults' needs at whatever age they are, teens, adults, it doesn't matter really. But the techniques of ABA can be applied no matter what age, and they can be used to teach everything from, potty training to learning to drive a car. So it's there's no real limit to how many years and the use of these techniques.
Wonderful.
And
Thank
and
you.
and to also go back to what you said, originally ABA was obviously it was found out through learning animal learning, right? So that's how people discovered, oh wow, this is a very effective way of teaching. But it has also a lot of other uses. For example, there's a whole area of psychology called organizational behavior management, where really this has to do more with teaching people, getting people to be more efficient and productive at work. So there's a whole field of ABA that has to do with employee behavior. Just as an example, there's lots of different applications of ABA, and applying it to kids with autism or individuals with autism is just one application.
Yeah, I think that some of it is this inflexibility that people have that they've seen one video of one kid doing one thing and they think, okay, that's all ABA. But I always think of ABA, if you've ever seen an artist that like goes places and isn't just in their studio and they have this role and they undo their role and it has all these tools in it that that they can take the tools out and they can use this paintbrush to make this effect and they can do this,
Right.
right? It's this big thing of tools, and that's how I think of ABA, that it's a big thing of tools and you can decide which tool to use on which individual to teach which thing, but it's an
Right.
array of tools. And even when I talk with parents about it, I always say Olympic athletes, their trainers are using the principles of ABA.
Yeah.
So it's not just a little
100%.
kid thing.
No, definitely it is applicable to all different types of behavior.
Well, that goes right into our next question, which is there an age where ABA would no longer be considered effective? My son is in an intensive ABA program, and I see how much it is helping him. I just got diagnosed myself as an adult. Would it be different for me?
Yeah, so it's effective no matter what age or issue, but it's different for different people. The focus of it, the techniques are all the same, pretty much. Like, when the techniques can be very, very stringently applied, or they can be more naturalistically applied, right? So, for instance, if I'm working with a child who has a very hard time even sitting for a few minutes and paying attention, I'm going to be very, very precise in my technique, in my use of the technique. So I'm going to give very short instructions. I'm going to prompt and model. I'm going to reward very heavily. I'm going to let the child, I'm going to reward on a very consistent schedule, those types of things. I don't want to get too technical.
Right.
But if it's an individual who is less uh, impacted by whatever they're struggling with, I can apply this much more naturalistically by just pointing out things in the environment that will get better if you do this thing. So, you work out, your weight changes. You work out, you build muscle. I mean, you know what I mean, Shannon? So there's lots of ways that you can use ABA. And it's that I think is very important because um, the program has to be very specific to the individual. Otherwise, it's not going to work. So the individual has always this is where the fair thing comes in, right? So let's say each person has a certain number of things that they should learn or want to learn in the world, whether it's playing a musical instrument or speaking a different language or learning about history or whatever it is, right? We go through life learning things. Figuring out how to pay our taxes. This is all just things that we learn all the time and then we use them. The content has to be understandable, comprehensible, not overly difficult. And the techniques we use for that are keep the instructions simple, prompt and model so that the individual doesn't get frustrated, etc. And then the reward has to be very applicable to that individual. There are certain things that might be rewarding to me that are not going to be rewarding to someone else.
Yeah.
And so the personalization of ABA is vital in order for it to be effective. So yes, it'll apply to both of you, but in different ways.
Okay. Wonderful. I also think, and maybe this is a side conversation, I have seen over the years, and even within the field, I feel this sometimes when I'm talking to somebody, that there is a confusion between DTT and ABA. And,
Yeah,
and to me, and correct me if I'm wrong, Dr. Granpeesheh, I always think of the SAT things where it's like DTT is to ABA, and then the one that's similar is that I say is DTT is to ABA as a steering wheel is to a car.
yeah,
Because I would never want to drive to Vegas without a steering wheel, but I would never try to go to Vegas with just a steering wheel.
right.
I wouldn't get
So,
there.
right, you wouldn't get there. And it's a very simple, it's kind of what I just explained. DTT is the most stringent kind of following the rules form of ABA. It's the most what we call experimental, like in the sense that it would be like very clean. Like every instruction has to be short, it has to be given at a certain pace. Every third trial has to be rewarded. It's very kind of, ordered. It's very ordered and very follows the rules of ABA because you're dealing with an individual who has a lot of issues or they're just starting out and it's kind of like teaching them the ABCs. It's the beginning of ABA. And it is it once the individual starts to master those things or starts to actually feel more comfortable with it, then you must actually do more flexible, looser versions of ABA, which is natural environment training, because you want to make sure that skill that was, let's say, taught on a very strict schedule of discrete trial training. That's what DTT stands for. Discrete trials, like when you teach something in a very, very specific trial, and the trial consists of this instruction and then a certain period that you wait for the child's response and then the consequence to the response, whether it's a reward or not, that is a trial. And DTT is multiple trials back to back, right? So it seems very rote and regimented, but it's only because it's the most simple,
Yeah.
clean, clear form of ABA. And when you've done that, then that specific piece of knowledge that the individual just learned with those trials now has to be generalized to real life. And real life is messy. So obviously, you will now take that piece of knowledge and test it in the environment and make sure that the thing they learned in this kind of very strict, orderly fashion can also be applied to real life. Because in real life, you might not get very short instructions. You might not have a very quiet environment where there are no distractions. You might not get your reinforcer immediately. You might get a different reinforcer a little bit later. So, all of those types of things have to happen in order for something to be considered mastered or learned. So, it is a series of processes that you have to go through, but ABA is the whole thing, and DTT is kind of a small part of it.
Yeah. And yet it seems like that there are some professionals that are out there that think DTT is the only thing.
Right.
And I will say that, I love video, but unfortunately when people videotape ABA, most of the time they're videotaping. I've seen a lot of videotape on YouTube where it's a moment of DTT. It's a trial. And then, I remember as a parent, the first time that I ever saw them say touch car to my child, I remember having that panic of, well, how are we going to get to college from touch car? Because
Right.
I had never seen that in my life. I had never seen how you can get from touch car to going to college. I've seen it now. I would know how to explain it to somebody now, but in the beginning, and I think that picture of DTT, and parents think, oh, well, this isn't what I want for my child. I think the better analogy that I've done before is if you go to learn the cha-cha, and you go to a cha-cha, place where they're teaching it, they're going to put the little plastic feet on the floor that have the 1 and the 2 or the left and the right, and they're going to start teaching you that way. But that is not where we're ending up. We
Right.
start with
Right.
that, but we don't end up there, and that's really what that DTT is. But I think it turns a lot of people off.
Well, I think it's interesting, Shannon, because if you were, we don't we evaluate when a parent comes in and has a child on the spectrum and someone says, oh, you should consider ABA. They go in with an evaluation mindset. I'm
Yeah.
going to go and see if this is something I like for my child. Okay.
Yes, you're right.
But parents don't go in with an evaluation mindset when they take their child to kindergarten,
Right.
right? Because it's a given. The curriculum for kindergarten is what it is, and my child is going to join all these other children. So nobody goes in and stands there and thinks, I wonder if it's okay if they're repeating the alphabet 20 times a day.
Right.
That seems kind of rote to me. What about all these worksheets that are matching and sorting? Why are they doing all this? I'm not sure this is for my child. Do you know what I mean?
Yes,
You
you're
do a
right.
ton of rote stuff in every grade, if you think about it, in every single grade. Well, if you're in 10th grade and you have chemistry, what are you going to do? You're going to memorize the chemical
Periodic table.
tables,
Yeah.
right?
Yeah.
So memorization is the rote part of pretty much everything. And if you teach another language, if anyone listening has learned another language, it is very similar to what we do with our kids. You first learn a bunch of nouns and which we call labels, and then you learn a bunch of verbs which we call actions, and you learn them in different tenses, and then you put them together in sentences. I mean, it's all the same thing. It's just that our mindset is that I should be evaluating the validity of this thing.
You're right.
Whereas honestly, if you put it side by side with schooling, which all of our kids go through, it would come out way ahead because it's very individualized, it's very rewarding, it's very built upon each other. And people don't, a child will not really struggle because you keep adjusting the program to meet the child's needs. Whereas in schooling, it's pretty rote if you think about it. So, different way to
Absolutely.
look at it.
I really hadn't thought about it that way before. You just lit a fire in my head, so that's good. I want to move on to another question. My son has been in ABA program for 11 years. He has made progress, but he is still very impacted and nonverbal. Do we keep doing ABA or do we try something different?
Maybe you want to try someone different. The reason
Mm,
I say that is that, 11 years, I've had kids for 11 years too. But let me tell you, after 11 years, there's very little left for them that they, so there's two, I don't want to say that. I want to talk about like what happens. So some kids when they start out, they're if you did everything by the book, all right, if you did like at least 3 years of very intensive work, and then you get to a point where the child is still lacking certain things, but it's not a lot, and they're more executive functions and cognitive and social skills and things that are advanced and take longer to teach. So, yeah, then it could be another 4 or 5 years of that, but at a very lower intensity. So, you're starting at a high intensity, and then over the course of time, you're just going lower, 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 because you want to fade out and you don't want the child to suddenly have no support. Also, the family. Like, you want to make sure you're involved until things are good for this child.
yeah.
So, that's one scenario. Another scenario is that I'm teaching wrong. Like, I might be not really doing things right. And if I was doing them right, this child would possibly learn faster and not need the 11 years. So I don't know what it is in your child's case, but I would suggest that you maybe go to another agency and ask them just to do an evaluation. I've done this many times for families where I will look at the child's program. What you could also, as a parent, you could do is you could videotape a few of the therapists and maybe your supervisor so that you have sort of something to show someone else. It's like getting a second opinion. You just want to get a second opinion and make sure that everything is being done right.
Yeah.
And if it is, and your child still needs 11 years of ABA, then I would have to ask you more questions. I would have to ask, did they receive intensive stuff in the early days, or did you never do intensive? In which case, yeah, it could go on forever because your
Yeah.
child really never had the opportunity to learn all the things they needed to learn. And I would then also ask you a bunch of other questions, like, is your child medically well enough?
Yeah.
Are they sleeping? Are they able to attend? When my children hit a plateau, I really want to then start kind of questioning what else could be going on. Why is my child not learning the way they should? Is it the technique that we're using? Is this a visual child and we're still giving verbal instruction? Are we going too fast? Are we going too slow on the child's board? Or is it a medical thing? Like the child can't attend and we need to deal with the ADHD aspects that some children struggle with? Or is it that he's not sleeping? Or is it that he has so much gastrointestinal inflammation that he's in pain? Like, you have to look at this from all angles and try to figure out why isn't there enough progress? And yes, there are cases where the medical, let's say I've had children where they have extremely active seizures and extremely inflamed brain inflammation, very severe brain inflammation. And then, yes, until we figure out how to deal with all that, it's kind of a waste of time to be doing ABA because the child isn't well. And, when you're not well, trying to teach you a bunch of stuff is just not right. That's where the fear comes in. So I think for this parent, maybe you have a second opinion about someone from the ABA field, but you also really focus on, is my child well, and how is he doing kind of from a medical biochemical perspective.
And we mentioned at the beginning the term medically enhanced ABA. Maybe this is a point
Yes,
to talk about that for just a couple of minutes.
yes,
This is a
thank
term
you.
that you've coined and that you feel
Yeah.
very passionately about. And I think anybody who hears you speak about it then feels passionately about it.
Yeah. So it's funny because this is one of those fields where I don't understand why yet, but there's no, and maybe other fields are like this too. I don't think so because I'm a psychologist as well as a behavior analyst, but and in psychology, there are a lot of disorders, illnesses, etc., where a physician and a psychologist work together. and they're very, you work well together. For example, depression, anxiety, all of those things have a component of each. And with autism, it's kind of a weird territorial thing where I feel like a lot of behavior analysts are just like, it's all about us and ABA, and it's almost like I don't want to say anything. It's just bad practice to not ask or learn or know about the child's medical status, because think about it, you are teaching an individual, a human being who might be suffering from many other things that need to have help and intervention so that this human being can focus, function, learn, and attend, right? So for me, it has always been very obvious that I have to look at the biology of the child. And in most cases, to be honest, Shannon, I have to make sure the biology is treated first. Because when you treat the biology of a child, when you treat the medical issues, it could be a lot of different things. Let's say it could be, gluten intolerance, casein intolerance. Okay, I put my child on a diet, then now I can see, wow. I mean, I have so much data on this too myself, Shannon, where you see children doing so much better when they have the right medication, right? And they're able to learn now and focus and pay attention and so on. They're no longer in pain. Their brain inflammation has subsided or is subsiding. So all of those things. So for me, it's very important to pay attention to the medical and make sure you're dealing with dietary issues, sleep issues, inflammation issues, toxicity issues, all of those, so that when you're doing the ABA, the child is just much more available, aware, attending, and believe me, I have so many different cases where I've seen that a medication that would really not have direct effect on learning has had a significant effect. I've had children where once they have candida, and you put them on a antifungal drug, and all of a sudden now the child is paying attention and learning in their ABA program, like at a much higher rate than they were when they were suffering with candida. Children who have had gastrointestinal issues, which once that is fixed, the child is a totally different child and is able now to pay attention. So many of these different things make such a huge, huge difference to the child. Children who are, running around screaming, unhappy, in pain, etc. Which and I'll be honest, you see a child like that, and if you start to try to treat it behaviorally, it's just not fair, and it's really bad practice. Because imagine if I always try to put myself in the same situation. Imagine if you go out, you and I both, it's funny that we're talking about this, you and I both last week caught some sort of bug,
Yeah.
where for 24 hours, 48 hours, we both had stomach issues, right, and felt nauseous and very sick and so on. Imagine if during that period, day one, where we were both really struggling, somebody came and said, sit down, I'm going to teach you 100 new things today. We're going to be working together for 6 hours.
Yeah.
And if you try to avoid or get away from this, I'm going to really insist that you stay and do this stuff. And it would be brutal. It would be unfair. And it's not taking into consideration how the individual feels, right?
Yeah.
Physically feels. Right now, there's a lot of conversation about assent, individuals giving us permission to teach them these things. Well, in my opinion, looking at the medical side of the individual is even more important, because it is really about how they feel. How are they feeling when you start to attempt to teach? So that's what medically enhanced is. It's basically take care of the medical side of things when you're doing ABA, because it will just boost your ABA, and you'll get much better results when the individual is feeling well, when they're sleeping well, and when they're ready to learn.
Amen to that. Thank you. A similar question, but slightly different. My teen has been doing ABA for 5 years now, started in COVID. When do we know that ABA has done its thing and we should stop?
Such a sweet question. Whenever you've reached your goal, I'll put it that way. So everybody comes in with a different goal. Some parents come in and their goal is teach my child every single thing he or she needs so that by grade 3, they can live an independent life and don't need any support. Other parents will come in and say, my child just needs a little bit of help. He's got really good language, but he doesn't know how to interact with peers. So can you please teach him that? Another parent will come and say, my kid's learning, but he's learned bad habits like using aggression and tantrums to communicate with his peers. That's not good. Can you please get rid of that? So everybody has different goals, and the goals are not just kind of what the parent wants, but also what's realistic, right? So, I mean, if you come at age 8 and say, hey, I've never had ABA before, but I want you to teach my child every single thing that he needs in order to lead a completely neurotypical life, I might be able to say, I might be able to say sure if he's mildly affected, or I'll have to say no if there are too many severe deficits and areas to address, and then I would pick the most important ones. So the goal matters, right? It has a lot to do with what you feel your child can accomplish, what you want for them, and also how much time you have. So how old is the child? How much work can we do? Can the child receive intensive therapies and so on? A realistic goal. And so we put those in place. And once you've achieved that goal in real life, then certainly you can stop doing ABA. Or you might then have a different goal at that point. It just varies for each family.
Okay. I would love to hear the doctor talk about what therapies does she recommend for a 12-year-old with high anxiety and autism. Does she still recommend ABA?
Yeah, that's a great question. So the most effective treatment for anxiety is a combination of medical and cognitive behavioral. So that is over and over has been proven. So medical, anxiety and depression have the same exact medications. Okay, so because we're talking about neurotransmitters, and these medications control our neurotransmitters. Neurotransmitters are kind of the communication system of our nervous system and our body, right? So if we have too much of them, sometimes we feel either anxious or depressed. It depends on each person on what type of neurotransmitter. But basically, the medications are antidepressants for anxiety. They're things called selective serotonin reuptake inhibitors, which is SSRIs, or SNRIs, which was serotonin and norepinephrine reuptake inhibitors. These are neurotransmitters. Serotonin is a neurotransmitter, norepinephrine is a neurotransmitter. And so we control those within the body. And generally, what happens is we are helping the body absorb more of a particular neurotransmitter, and that tends to reduce anxiety very effectively. Now, at the same time, what is often done for patients with anxiety is cognitive behavior therapy. And cognitive behavior therapy are techniques that are taught to the individual that will help them cope with their own anxiety. So they could be techniques such as breathing. There's a lot of different breath exercises. Breathing into account, holding your breath and breathing out. Those types of things tend to calm. Or they could be concepts that we teach the individual. Things like, you're just having a thought right now, and this thought isn't reality. It's not the real world. It's just something in your mind. It's called a thought. What you're doing is this type of behavior that's called catastrophizing. There's lots of different things. You teach a person, and they come to realize, oh, wow, the things that make me anxious are not really real. They're just in my mind. And that would work with someone who has the ability to comprehend those cognitive behavior therapy concepts, right? Because obviously, if you're talking to a child who's, let's say, 4 or 5 years old and they're very severely affected by autism, that kind of intervention isn't going to work. But if you're talking about, let's say, a 12-year-old who is minimally affected and really understands language and understands the concept of thoughts, then that would work. Now, some people obviously don't like medication, so they will only do cognitive behavior therapy. Others are like, hey, give me a fast fix. They will only do medical. But literature shows that dealing with anxiety, the combination of the two is always the most effective. Okay. Should you do ABA? It depends. In my mind, there's one, if a child has a very high level of anxiety, I would probably pause and take care of the anxiety before I try to teach a lot of other skills. Why? Because failure, and we all fail when we're learning, right? So you get certain things right, certain things wrong. Failure to an anxious person is a lot more jarring than it should be. So I don't want that anxious individual to feel like a failure, because that's going to really increase their anxiety and could even pop them into depression, which is kind of the other side of anxiety. So I'd rather first get the anxiety a little bit under control and then embark on using behavioral techniques to teach things. If the anxiety is not that severe and the individual is actually really sharp and is learning fast, has a very high rate of acquisition, then I probably would do ABA, because it would be right off the bat a very successful experience. And when it is a successful experience, it'll help the anxious individual feel better about themselves, and then the anxiety will subside. So you have to be very careful about the interaction of autism and anxiety, and kind of make sure that what you're doing is not going to make one or the other worse.
Okay, good point.
Very complex answer.
No, but I love it. I absolutely love it. Is 8 too old to get an autism diagnosis? If he does get a diagnosis, is it too late to do ABA?
No, it's not too old. I've diagnosed adults who all their life thought there's something going on with me and I wish I knew what it is. Certainly, you can seek out a diagnosis at 8. Oftentimes, the individual, if they haven't been diagnosed and they're already 8, that means that if they do get a diagnosis, they're very minimally affected. They're affected in all the areas that have to do with autism, but very minimally. Or they might not get a diagnosis, and their diagnosis might be something completely different, like social anxiety. So I think it's always good to get a diagnosis if you feel like there's something that's interfering with life. And then, no, it's never too late to get the appropriate treatment.
And the last question that I have in this format is, can someone be too smart to qualify for an autism diagnosis? And this question came because we have a parent that the school recently told them in an IEP meeting that they evaluated her daughter, not for autism, but the school said, well, they're just too smart to qualify for an autism diagnosis. The school, who isn't qualified to diagnose autism, and it made me want to spit nails.
Yeah.
But we want your thoughts on it.
Yeah, I just wish people would kind of stay within their realm of expertise and not make comments like that to parents. So IQ has absolutely nothing to do with the diagnosis of autism. It's not part of the diagnosis. In fact, a lot of people that I do diagnose have either normal IQ intelligence, or they have much higher IQ. I have had children whose IQ is intelligence quotient is like 2 standard deviations above the norm, and yet they still have a diagnosis of autism. It has nothing to do with each other. It does correlate in the sense that if your IQ is extremely low, then it just becomes harder to teach, right? But for individuals who have very high IQ, the ABA has to be adjusted because they will get bored quickly.
Yeah.
And so things have to be given to them relatively fast. But you absolutely can get a diagnosis with the highest IQ.
There we go. And
In
then
fact, Shannon, there are
yeah.
lots of very, very, very intelligent people in the world, like Elon Musk, who have come out and said, I have autism.
Yes.
You know, so that's a clear thing.
Yeah. And then my personal wish for you to talk about today is that we've had a lot of parents recently saying, okay, what is this graduate from ABA thing? And I think there's some
Yeah.
misunderstanding around that. And so I'd love for you to talk about it within the context of CARD. What does it mean when your child graduates from their
Right.
CARD program, which I think is significantly different than at other ABA providers? Um,
Well, so typically we use the term graduate for kids who have entered a comprehensive program, and the goal is to get them to a point where they no longer qualify for a diagnosis of autism. So they have learned everything and all of the things that they need to, and now they are functioning with neurotypical peers and no longer would by anyone be given a diagnosis of autism. So they've lost enough symptoms where they just don't qualify for the diagnosis. And that is someone that we would graduate. That said, as I said, we're having more and more kids come in who just need help in one or more other areas. And certainly they're graduating from the program when they stop doing ABA because we've reached our goals. But it's a little bit different, you know, and I like to try to talk about it a little bit differently because the individuals who graduate and have lost their symptoms have typically been doing ABA for years,
yeah.
very intensively.
Yeah.
And they've now reached a point where they no longer need any of their behaviors or symptoms to be changed in any way because they're functioning as well as peers.
Okay. So I guess as I think about this, when Jem graduated, I'm not sure which category he was in because I remember what somebody said. I don't know whether it was you or Sienna or whatever. They said he has learned all the things that he needs to learn to go learn in the environment.
Exactly.
That
Exactly.
he wasn't done by any stretch of the imagination, but he learned how to learn in his environment, and now his
Right.
job and our job as parents, we were to take him out into the world and
Mhm.
have him apply everything that he had learned to the world and
Right.
have that teach him from the world. It was a very
Absolutely.
exciting and scary
But
time. Yes.
no, absolutely right. But also, he would not have qualified for a diagnosis of autism anymore.
I
And
I
so,
think that's
even though there
probably
are a
true.
lot of,
Yeah.
sorry, say what were you saying?
Well, I said I think that's probably true. I don't know that I
No,
owned
no, that's
that in
true.
that moment, but
No, that's true. This is what people don't understand about the diagnosis of autism. It isn't, uh, an individual might say, I'm autistic and I'm always going to be autistic.
yeah,
But this is what I've always said, right? From a diagnostician's perspective, from the perspective of a clinician who diagnoses, from the perspective of the Diagnostic Statistical Manual of Mental Disorders, you either are in or you're not. It's
yeah.
a very clear distinction. And autism has very specific criteria that you have to meet. And at that time, when he stopped receiving services, he wouldn't have met those criteria anymore.
That's so interesting because I
Maybe that's
don't think
simple.
I owned that at that time.
Yeah.
I later I maybe did.
That's usually our thing, Shannon. It's like, oh, he's not going to qualify anymore. And, it's a very quick look at, okay, are there specific speech and language deficits that are severe enough? Probably not. Are there behavioral challenges that are severe enough? Probably not. Is there maybe some social stuff that's still going? Probably yes. But that on its own is not enough.
Yeah.
Do you know what I mean?
Yeah, I do. And interesting enough for us, when he started high school, the school had to do a triannual,
Hmm.
and they did the triannual, and the school psychologist came back and said, "I see no evidence of autism except that there's a report that says he was diagnosed when he was 2.5."
Right. There you go.
And then I think I went okay, but it took
Yep.
me a while, you know.
Yeah,
Um,
because you weren't, because you were really just focused on how well is he doing in life,
yeah,
which is a fantastic thing, which is what I try to tell all parents. This is not really about that word, does he qualify or not? That's
right,
not what it's about. I mean, it is initially because that way you get funding,
yeah,
but it's more about how well is he doing in life, right? Because if there was like a category, if there's like a diagnosis of neurotypical, right? Just think about that.
yes,
We all would have different levels of it. You know what I'm saying? And so there's no real benefit at that point to be just saying, oh, he doesn't have this anymore. He could be struggling with a lot of other stuff. It's
yeah,
all about how well the individual is doing in life.
yes.
And at that point, I think you were very focused on that, and that's why you supported him in the right areas, and that's why he succeeded. Because you were more focused on what do I need to give him at this point in his life for him to be successful.
Yeah, amen to that. We just have about a minute and a half left, and I just wanted to say though, I think the crux of this conversation for me is that there's a whole lot of people who could stand to do some more investigation of good quality ABA,
Right.
for themselves or their children, and think a little bit more flexibly outside the box of, I feel like if I were to go to all those people and say, hey, would you like a method of learning that's specific to you and that rewards you in the way that's meaningful to you? Would that be exciting for you instead of what you've been doing, either for you or for your child, that everyone would say, oh my God, I've been looking for that?
Right.
And that is what good quality ABA is supposed to be. And I just want to say to anybody, any parent or any person who's participating in ABA where that isn't happening, that you should ask more questions, because that to me is what ABA is, and
Right.
it's what it's supposed to be.
Absolutely.
Well, and you've been doing that to great effect. I'm always so impressed whenever I get to hear the stories of the kiddos that you have treated, and we have that happen from time to time where somebody shows up or they write in and talk
Oh,
about
so
what,
nice.
and it levels all of us. We
Oh,
just,
it levels me. It's so amazing. It's just so amazing. When I see, when I run into people or meet them and they're like, you've done so much for us. What can we do? And I'm like, just, let me videotape where you're at and where your child is so that other parents can have hope. And it's incredible. It's so, so, so touching. It's the most emotionally influential thing in my life when I see these individuals. Yeah.
well, it's what I said to you the other night. It's your legacy. This is your
Thank you,
legacy.
Shannon.
It's
I'm
amazing.
very lucky. Thank you.
We're very lucky. Are you kidding me? So, thank you so much for being here, and thank you to our audience being here. Tomorrow, on tomorrow's Autism Live, we're talking about how to do gluten free Thanksgiving, gluten free and dairy free Thanksgiving. So, you guys will want to tune in for that. But always, Dr. Granpeesheh, we appreciate you so much more than you could possibly know.
Thank you so much.
We want to give the programming note that we won't be here doing live shows next week. We're ramping up for the Festival of Toys the weekend after. The toy guide will go live next Thursday, God willing. And then we'll be back with you, and we'll be talking about toys and things of that nature. So we'll be back that week before Thanksgiving, you guys. But check out the toy guide next week, and then be with us tomorrow to talk about gluten-free Thanksgiving. Thank you so much for being with us, Dr. Granpeesheh. Thank you to our audience. We'll see you
Thank you.
tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific.